following series of short videos will focus on the subject of bipolar disorder and a wide-ranging number of issues related to this form of mental illness. Can you tell which of these people is bipolar? In America today, more than 2 million adults, or about 1% of the population, have bipolar disorder. Unfortunately, many people suffer for years before being properly diagnosed. Like diabetes or heart disease, bipolar disorder is a real illness that must be carefully managed throughout a person's life. What is bipolar disorder? Bipolar disorder causes dramatic mood swings, moving from overly high or even irritable mood to depression and sadness and hopelessness, and then switching back again. Often there are periods of normal mood in between. Severe changes in energy and behavior go along with these changes in mood. The periods of highs and lows are called episodes of mania and depression. Bipolar disorder, also known as manic depressive illness, is a brain disorder that causes large shifts in a person's mood, energy, and ability to function. These are different from the normal ups and downs that everyone goes through in life. The mood swings of bipolar disorder are extreme, and they can result in damaged relationships, poor job or school performance, and even suicide. But there is good news. Bipolar disorder can be treated, and people with this illness can lead full and productive lives. What are the symptoms of bipolar disorder? According to the DSM-4, that's the Diagnostic Statistical Manual of Mental Disorders, there are two basic components to this disease: mania at one extreme and depression at the other. The signs and symptoms of mania may include inflated self-esteem or grandiosity, decreased need for sleep. He or she may be more talkative than usual or feel pressure to keep talking. There may be a flight of ideas or a feeling that their thoughts are racing. They may exhibit distractibility. Their attention may be too easily drawn to unimportant or irrelevant stimuli. They may have an increase in goal-directed activity, either socially, at work, or school, or even sexually, or they may have psychomotor agitation. Another sign is excessive involvement in pleasurable activities that have a high potential for painful consequences, like engaging in unrestricted buying sprees, sexual indiscretions, or foolish business investments. The signs and symptoms of depression may include being in a depressed mood most of the day, nearly every day. He or she may have a markedly diminished interest and pleasure in all or almost all activities. There may be a significant weight gain or loss when not dieting. There may be insomnia or hypersomnia, which is sleeping too much. They may exhibit psychomotor agitation or retardation. He or she may suffer from fatigue or loss of energy. There may be feelings of worthlessness, excessive or inappropriate guilt, which may be irrational. There may be a diminished ability to think or concentrate or indecisiveness. They may have recurrent thoughts of death, not just a fear of dying. They may have recurrent suicidal ideation without a specific plan or an actual suicide attempt, or they may have a specific plan for committing suicide. Any of these signs should be taken seriously, and a health professional should be contacted immediately. Please note that the symptoms of bipolar disorder are very complex. The information offered in this video is only intended to be informational and does not provide sufficient information for a diagnosis. A diagnosis can only be made by an experienced, trained professional. The information source for this program was adapted directly from publications from the National Institute of Mental Health and the DSM-4. If you suspect you or a loved one may be suffering from a mood disorder or other mental illness, the most important thing you can do is get help. To learn more about mental illness or where to get help, you can visit our website on the internet at bipolarhelp.org. That's www.bipolarhelp.org. In our next segment, we'll focus more on identifying other issues in dealing with bipolar disorder. Thank you for watching.